Let me begin by bringing up to the podium some folks who have enormous experience professionally and personally in terms of healthcare. And they're going to explain to us and to the many people watching us on live stream as to why we need to move toward a Medicare for all system. Please welcome Dr. Sanjeev Sriram, who is a pediatrician in Southeast Washington, D.C., and an assistant professor of pediatrics at the George Washington University School of Medicine. Dr. Sriram.
Good afternoon. My name is Dr. Sanjeev Sriram, and I'm a pediatrician in Southeast Washington, D.C. For 7 years, I have cared for a patient I'm going to call Sean. I met Sean when he was 13, newly diagnosed with type 1 diabetes and still adjusting to checking his blood sugar and regularly doing those insulin injections. I earned his trust because I never judged him when he had setbacks, and I always kept it real. Sugarcoating is not recommended for diabetics. Together, we have made his diabetes and his mental health issues manageable conditions that he controls rather than his conditions controlling him. He is now 20 years old, a graduate of a rigorous vocational skills program, and eager to get a job. 2 months ago, Sean told me he wanted to look for work in Virginia, but then he would not have Medicaid like he does now. Sean's mother has become a friend of mine, and I've recently learned her health is struggling. She will not be eligible for Medicare for at least 10 years, and none of her 3 jobs come with health insurance. Fortunately, she lives in D.C. and qualifies for Medicaid, but if she lived in her home state of Texas, she would be uninsured. Sean and his family are like hundreds of patients I see in Southeast D.C., and they are like millions of patients community physicians are seeing every day across America. I greatly appreciate how the Affordable Care Act has made life easier for Sean and his family, but their experiences highlight ongoing problems with our healthcare system. Uninsured African Americans are twice as likely as white people to have no coverage if they live in states that have not expanded Medicaid. Too many women and low-income families are stuck in Sean's mother's situation, working multiple jobs with no health benefits, or they're wondering if their health insurance premiums are worth the financial sacrifice. As a physician, I know what Medicare for All would mean for patients like Sean and their families. It would mean we are finally making healthcare a basic human right, no matter what you earn, no matter where you live, and no matter what you look like. Doctors like me, and patients like Sean, and mothers like his mom, have not worked our butts off to stay healthy and alive just for insurance companies to price people out or for politicians to play games with the basic human right of healthcare. When it comes to health policy, a lot of people quote Senator Ted Kennedy, but I want to echo his older brother. On this day, 55 years ago, President John F. Kennedy challenged Americans to reach for the stars. Today, I am asking my fellow Americans to reach for their hearts. We choose to build Medicare for all. We choose to build Medicare for all now and do the other things, like cheaper prescriptions and reined-in healthcare costs, not because they are easy, but because they are hard. Because Medicare for all will serve to organize and measure the best of our energies and skills to improve American healthcare. Because that challenge is one that we are willing to accept, one we are unwilling to postpone, and one we intend to win. Thank you.
Good job. Well done. Thank you.
Thank you, Doctor. Melissa Johnson Camacho is an oncology nurse at a major teaching hospital in Northern California. She is a member of the California Nurses Association, National Nurses United. Melissa?
So like Bernie was saying, Senator Sanders, my name is Melissa Johnson Camacho. I've been an oncology nurse for almost 10 years. I've been working hard with National Nurses United and the California Nurses Association all across this nation. We're trying to make a more humane healthcare system. We want one that's based on patient needs and not pain and profit. I'm here today because of my patients. I'm here to advocate for them. And for cancer patients, Medicare for All would be crucial. It would be an enormous relief. And for some, it's going to mean the difference between life and death. Most people don't realize that a cancer diagnosis is not just a very frightening diagnosis, but what comes with it is also financial devastation for far too many. And because of high deductibles and out-of-pocket expenses, we have tragic cases of people who don't even get to the treatment that they need. There are patients that I think about every day. One young woman still lives deep in my heart. Her cancer had metastasized, and her lungs filled with fluid consistently. She needed to have the fluid drained in order to breathe, to survive. I noticed she never completely emptied the bags, which meant her lungs never were all the way clear. When I asked why, it was because she could not afford to change the bag more than just once per day. These bags are very expensive, and her insurance did not cover the full cost. She was never able to take a deep breath, and she lived in constant distress and pain, struggling to breathe. And to make matters worse, the insurance policy soon renewed. That meant her annual deductible was in place, and she would have to pay the full amount of her medications and supplies until that deductible was met. That young woman spent the rest of her life in unnecessary stress, unnecessary pain, and unnecessary agony. She never again was able to take a full breath for the rest of her life. And as far as I'm concerned as a nurse, this is treatment denied. This is treatment she needed and deserved. Thank you. Thank you. To me, it is immoral that anyone profits off another person's need for health care, and it is repugnant to me that this profit comes from denying care. I see the suffering and pain this causes every single day in the faces of my patients. This system is killing too many of my patients, and I say no more. Let's put an end to this immoral system that's putting profits before patients' needs. Registered nurses like me know the only way that we are going to do this is with Medicare for All. I want to thank all the senators that are co-sponsoring this bill. And healthcare is a human right, and we are going to make it happen. Thank you.
Rebecca Wood is a mother and patient who is sharing her story with us of choosing between her daughter Charlie's treatment and her own. Rebecca? Do you need help with the baby?
I'm going to send her to bed.
Some of us.
Okay.
Hi, I'm Rebecca Wood. I'm from Charlottesville, Virginia, and this is Charlie.
Hi, Charlie.
She's kind of bouncing around the room, as you guys may have seen, so I'm going to send her to Ben. You want to go sit with Ben? He's got your goldfish. Okay. My family story begins like many. My husband and I met, graduated from college, got married, found employment, and decided to start a family. Our story diverges from the norm at my child's birth. Due to preeclampsia, my daughter Charlie was delivered via emergency C-section 10 hours into her 26th week of gestation. She weighed 1 pound, 12 ounces, and was the size of my hand. My constant NICU bedside vigil started because I did not want her to die alone. Charlie was tough and a fighter. After 3 months, she was well enough to come home. We thought it was over, but it was merely the end of the beginning for us. Issues from her premature arrival appeared one after another. Each one required treatments and therapies. There was specialty formula, medications, and formula thickeners. After that, she needed physical therapy, speech therapy, occupational therapy, and orthotics. The list grew and continues to grow to this day. Charlie's determination and perseverance served her well. She responded positively to therapy. OT gave her the use of her hands. It's a good thing because she wants to be a doctor and a drummer. PT made it possible for her to run and jump, as you guys have all witnessed. And speech therapy is why she can talk and say, "Mommy, I love you." Her developmental progress far exceeded initial expectations. However, all of it came at a cost. I had to make impossible choices. Should I pay for her therapy or my exorbitant asthma medication copay? Choices like these aren't impossible, really. I choose to pay for hers and go without mine. One day, I needed an expensive dental procedure. Unfortunately, it was at the same time a therapy payment was due. Charlie's speech was emerging. I was afraid we would miss a window of opportunity in her development if we cut therapy. I chose to pay her therapy payment and put off my dental procedure. The decision cost me dearly. Due to the delay, an infection spread throughout my mouth and jaw. I went to the emergency department because the swelling in my mouth obstructed my airway. After a course of IV antibiotics, I was discharged. The next day, I had all of my teeth pulled, the infection drained, and parts of my jaw scraped away in a 6-hour procedure under local anesthesia. I could not afford to have it done under general anesthesia. I cried the entire ride home afterwards. Stories like mine should not happen anywhere, but certainly not in our country. Our healthcare system is broken. It's time we look to single-payer healthcare as a way of ensuring that families aren't faced with impossible choices like mine.